This lecture is going to be on Chapter 16 in the Dental Public Health and Research NABE textbook. So to begin, all research is going to begin with a question. And that process is going to start with the question. It will move into why that question is significant. Why are we studying it? What is already known about that topic or about that question that you're asking. You want to make sure you don't ask the same question or, try to find something that is already known. And how do we go about finding that answer? Once you know your research question, and you, of course, are using the material we used last week about PICO and finer, right? You've got a complete round question. You're going to probably create a research proposal, and that's going to have to consist of your research question, which is, PICO and finer, and then you'll probably end up conducting a literature review, which we'll talk about more in a later module. And then you're going to have to choose a research approach or design, and you'll write all of this material out. And typically when you're doing research, you try to find funding for it. Somebody will pay you to do this research study. And so you'll write out all of this material, and then you'll put it in some type of grant proposal, or you'll take it to a company, try to get them to give you some money. So every research study that you read that's been published is going to have the following components. In the first part, there's going to be the introduction, and it's going to state the P in PICO, the problem, and it's also going to talk about the significance that it has on the population that is having that problem. And it will also give you operational definitions. Basically, it will define some of the key terms that they're using in that study to make sure that the verbiage is understandable by the reader. And then the review of literature will obviously have an introduction. Everyone does. And then it will introduce certain research articles that they found that pertain to the topic that this study is going to be looking at. And then usually summarize. Typically, they'll explain where the gap in the literature existed, and that will kind of lead you into why this study was being done. Then in methods and materials, again, they'll introduce what they're talking about. They'll do a sample where they explain how they got the sample and how they manipulated the sample, whether it was randomized or if it was innate things that they had to, it wasn't randomized sort of situation. And then the research design, so it'll talk about, whether it was experimental or if it was, a case control, anything like that. And then it will talk about the procedures that were used in the study, whether human subjects were addressed. If human subjects were used, they'll talk about, whether they have the informed consent and how they went about, explaining and recruiting subjects. It'll go through the tests that were used, the materials that they used in order to complete those tests. This one is more what kind of indices did they use? The time schedule, so if the study was conducted over 6 months, or was it just they had people come in, they tested them, and then they left and they never followed up kind of thing. It'll explain the time. It'll explain any assumptions that were made. We talk about this in a later portion of the class, but every research study does make certain assumptions, and every research study has certain limitations that is just kind of built into the study that cannot be you can't go around those kinds of things. They're just a part of it. And they want to make sure that the reader is aware of each of those things, assumptions and limitations, in order to be fully transparent. They will do a result and discussion. So they'll, explain the data. They usually have charts and graphs and things like that that will help to, explain the data. And then they will discuss basically the results. They'll say, whether the data supported or didn't support what they found. And then if it didn't support it too, they'll explain what exactly does that mean. then usually in the conclusion, they'll state whether or not their hypothesis was proven, which, I mean, they're always talking about the null hypothesis, which we'll talk about in a minute. And then they'll do recommendations for further studies as well. So they'll say, you know, this is what we found, but we aren't able to find this component of this topic because of this limitation, right? So they'll propose a future research study. So the next step in a research sort of process is to potentially need to do a pilot study. So if there hasn't been a lot of research done on the specific topic that you're doing, you know, you're not replicating anyone else's studies, then you're going to be kind of doing your own thing, right? And you need to figure out how the research study will be run. And a lot of things can happen, a lot of things can go wrong in the middle of your research. So what researchers will do is they'll conduct something called a pilot study. And it's basically just a small version of the proposed study. It gets carried out on a small, sometimes intentionally chosen sample. We're going to talk about samples a little bit more this chapter and then again later in the term, but we're going to specifically pick out people we want to be in our pilot study because we think that they will be good samples and will help give us the feedback that we need in order to evaluate our research study critically and in a manner that's going to give us, you know, the best path forward. And so it's a way of working out some of those unforeseen errors in the overall plan for conducting a study, which is called the research design by doing a trial run. So why would we do a pilot study, right? We already planned it out. We already did our literature review. We know a lot about it. Well, the reason we would do that is because a lot of things can go wrong, and you want to try to find if what your idea, if it's going to measure the thing you think it's actually going to measure. Because sometimes you get started on a research study and what you think is going to measure whatever it is actually doesn't. You know, it doesn't measure it effectively, or it just doesn't relate to your research question, and so you'd have to scrap an entire large project. A lot of times if your study is large and it's going to require money, you have to either get a grant through like the government or like a private grant, and in order to get people to give you money, you have to show that your research study is going to be effective. It's going to work. So you have to sometimes do a pilot study in order to prove that the study will study the thing you think it's going to study, so that the people with money will give you their money. And then there's a lot of bias that goes along with a pilot study. So I want you to be aware of that whenever you are looking up research and you see, you know, whatever type of quantitative study, it's a pilot study, then you need to be aware that a lot of times in pilot studies, because they're choosing those samples, because the sample sizes are so small, there is a lot of innate bias in the research study. So the findings from a pilot study are not going to be as good as the findings from a study that's not a pilot study. When it comes to variables, there's a couple of different things we want to keep in mind. And so first is independent variables. The independent variable is the thing that is the intervention, if we're talking about PICO. It's the thing that's in the experiment that the researcher will alter in some way. The dependent variable is always the thing that the researchers are studying and measuring to try to figure out if the independent variable affected it. And if you think about it like they're dependent on the variable that got changed, whatever this is, that's going to help you remember, you know, dependent versus independent. The other variables are considered either controlled if it's a very good study. They will control all of the other variables possible in order to make sure that they are not confounding variables, which we'll talk about confounding later. And then extraneous kind of just means other. So you want to control all of the extraneous variables. So every research study or proposal has a question that they have to answer, right? Why the research is being conducted. And they call this the hypothesis. So a hypothesis is a question that's going to be answered by the study. There's two different hypotheses that can be either proven or disproven. And typically what we go for is the null hypothesis. So in a research study, if you say, I think that this toothpaste will work, that's going to be the research hypothesis, or it's also called the positive hypothesis, and in some places it's going to be called the alternative hypothesis. But that is basically what when you start out to write, a research study or conduct a research study, you'll probably have some type of research or positive or alternative hypothesis stating this is, these two things are correlated. These two things affect one another. That's what your hypothesis is going to be. However, in every research study, there's going to be a null hypothesis. And basically, the null hypothesis is the opposite of whatever your your hypothesis is. So if your hypothesis is that, this toothpaste reduces caries, then the null hypothesis is that the toothpaste doesn't affect caries. Not that it doesn't that it causes caries, right? It's not going to be exactly like that. It's always kind of the neutral. If you think of null as neutral, then it will certainly help. So the image here is that the null hypothesis assumes there is no relationship between the two variables, and that controlling one variable just simply doesn't affect the other one. Okay, so in this, cats show no preference for food based on shape. I personally think that that's true. I don't think cats choose based on shape. I think they probably go off of smell. And then in this one, plant growth is not affected by the light color. I think as long as there's, enough UVA, UVB in the light, I don't think that the color of the light affects whether the plant will grow, although I don't know, I've never done that study. And then in this last one, it says age has no effect on musical ability, which, I, again, never done that research study. I don't know that much about that topic, but I mean, it's possible. But in any sense, the idea here is that things are neutral. One doesn't affect the other one, or there's no relationship. Every time you write a research study, you will either accept the null hypothesis, or you will reject the null hypothesis. And so whenever you read, sometimes they get into like a negative, double negative, triple negative kind of sentence. And you want to be very, very careful when you read a type of sentence about whether or not you accept or reject the null. Because sometimes it will say that you accept the null hypothesis, which means that your research hypothesis, the outcome you thought you would get, is not true. There's no relationship. So you accept the null or the neutral. If you fail to accept the null, then your research hypothesis was actually right, because you failed to accept the null. If the null is neutral and you failed to accept it, then your research question was correct. They'll also say things like you reject the null, which means that if you reject the null hypothesis, that neutral isn't right, and your research hypothesis was right. You were right. If you fail to reject the null, that means that you can't reject the null, so your research is wrong. Things get really tricky here, so make sure that you're paying very, very close attention to the way that these words are formed. So on that note, roses are red, violets are blue. If you were a null hypothesis, I would fail to reject you. And again, this is just a funny way of thinking about how twisted the words can get when you're talking about the null hypothesis. And so if you were to fail to reject the null hypothesis, that means that you would accept the hypothesis, and that I guess you would be in love with the mouse. A historical study is meant to determine the meaning of past events. So you might do like a records review, an interview, or a literature review. All of these will try to find out something about something that happened before. The limitations for this study is going to be the location of accurate data. Sometimes you don't have all of the data, and sometimes like it might be that the data exists, it's just that you personally don't have access to it. There could be gaps in the knowledge, and honestly, the gaps in the knowledge could be because the person who wrote whatever or took whatever notes, maybe they weren't the best at, being able to record that kind of information. And so then there's a gap. No ability to replicate. So, once the data is written down, you can't go back and try to figure out, well, can I make this happen again? Because it's already happened. There could be bias in the reports. This one is the one I hear about, well, that I think about when I think of history, because history is typically, as the phrase goes, history is written by the victors, which is a terrible way to think of it, but we don't necessarily know if history is correct. We just know that that's the account of the people who were around and were capable enough to write it down. And then there could be a distortion of events. Again, if history is written by someone who doesn't, or maybe is ashamed of their part that they play, and then they write down something else, then it was going to skew the data. Pretty much all research is going to fall into one of these two categories. Either it will be descriptive research, and then it will attempt to identify and describe who, what, and when, or it will be analytic research that attempts to establish the why and the how of whatever it was. Anytime you're looking for those keywords when you're reading questions, or you're looking at information, you're looking for describe goes with descriptive, and the why typically goes with analytic. I just thought this quote was really cool, but basically overall strategy that you choose to integrate the different components of the study in a coherent and logical way, thereby ensuring you will effectively address the research problem. It constitutes the blueprint for the collection, measurement, and analysis of data. Note that your research problem determines the type of design you should use, not the other way around. And basically, it's like you have a question and you want to know the answer, you want to find the answer, and you want to figure out how to find the answer. Well, study designs are how you figure out how to find the answer. After historical is going to be a descriptive research approach. This is in your book. It's in a chart on page 198. But for the first part of surveys, the first part of descriptive is a survey. This is going to be either oral or written, can be either, and it's meant to gather broad information about the status quo. Basically, it measures the knowledge, attitudes, and values in order to determine the need for the research study. The methods that are used are going to be questionnaires, opinionaires, interviews, and indices. I feel like we've all taken a survey at some point in time. The limitations are going to be lack of depth or no intervention. So basically, when you're filling out a survey, you don't often get to, give a lot of feedback, right? You have to answer the questions that are asked. You can't just write in anything you want. I guess you could, but that's Q's data. So in a survey, you're giving people options to choose from, and they're not able to really give you insight into more than what you're already asking them. We're still in descriptive, so here are the differences between a case study and a case series. Sometimes we'll see these, and they, while often used interchangeably or like they'll get lumped together a lot, they're just a little bit different. There's a little nuance here. In a case study, this is going to be written about a single person or incidents. whereas with a case series, it's going to be written on a small group of people who have the same problem or condition. Both of them cannot be generalized to the overall population because the sample size is entirely too small. And because of that uniqueness means that we can't replicate it, right? If we're studying a disease or an incident that occurs, once in, 10 million people, well, it's going to be pretty hard to study someone else, right? Which means that whatever type of conclusions we make about the case or the series, they're going to be subject to bias. Whoever the researcher is going to make certain assumptions, and we will be unable to determine if those are correct. And there's going to be unrecognizable chance variables that might exist simply because of the number of studies. We talked about extraneous variables and trying to control those. But when the case or the sample size is so small, it's almost impossible to be able to control all of those other variables because we just lack control here. This is a good time to talk about cherry picking. So when you only study one tiny small sample size out of the overall sample, it's going to lead you to make certain assumptions or to lead you to certain conclusions about data that is possibly not true. In this case, if you were to reach up and pick a cherry out of this tree, it means that there is a chance that if you only pick one cherry, little bunch, I guess, you might think that the entire tree is full of blue cherries. But that's not true, right? That just means you're only pulling one tiny little viewpoint and you're not looking at the overall. This is why in sampling we want to have as large a sample as we possibly can handle so that we get a more accurate information. So we're still in a descriptive study, but you know how before we talked about retrospective and prospective, which has to do with time, right? Well, a cross-sectional study also is very specific when it comes to time. And in this scenario, cross-sectional, this is a single point in time. So in this study, we're not looking at information that was recorded before, and we're not going to continue to follow people after the study. We are simply going to look at two different variables, the independent variable and the dependent variable, and where they are exactly at this moment at the same time. So here in this example, this study is looking at high cholesterol and how BMI may or may not be correlated with high cholesterol. So here they measure the individual's BMI and they put them into two categories, either over 30 or under 30, and they measured their cholesterol at that time. And that's it. That's all the data that they're going to collect, which means that there could be more information at play here than what they've collected. That might be one of the issues with this. But typically cross-sectional, because you're not gathering information from before and you're not going to continue to gather information, it has a good deal of like validity. It has a good deal of like you can trust this source, typically. We're continuing in descriptive, so next is the cohort study. This is a type of study that is also called a longitudinal. It means it happens over time. And in this case, a cohort study, depending on where you are in the study, it's considered prospective. So when you start, you look at this group of people and you say, okay, I'm going to follow them over this next certain amount of time. And then when you finish, when you get to that certain amount of time has passed, then you measure whatever the thing it is you're measuring again. This is why we call the students in our program cohorts, because we follow you over time to see whether or not you become dental hygienists. So in this one, the study is intended to study the same population over the extended period of time. The limitations here are that it's a pretty time-consuming process, right? if you're going to study someone for a year, it's usually not that big of a deal. But if you try to study the same group of people over 10 years, that's a long time. And there could be an extended financial commitment. If you're following someone over 10 years, then you're consistently paying them to come back to, get studied again, and to follow up with those individuals, and that costs money. And then when you follow someone over time, there is a chance that you will lose some of those subjects. People move away, or they, maybe they get pregnant and decide to drop out of your study for some reason, or just anything could happen to them, that maybe they die, or something could happen to any of your subjects at any time, and that means that they will withdraw from your study, and that's going to mess up the information that you have. If you say, we started with 50 subjects and we ended with 45, the people who read your study are going to be like, well, what happened to the 5 people? And you have to describe what happened to them. Some other descriptive studies, or just kind of names for these things, is going to be a developmental study. It's pretty similar to a cohort study, but basically just looks at events as they exist. It doesn't make an intervention, but it just simply observes them over time. So maybe it follows, how children, your book, it gives the example of following children as they grow in order to see how their periodontium changes over time. In a trend study, trend is one of the very unique ones that you're going to want to remember, but basically a trend study will look at descriptive information and historical information in order to predict. So how we always talk about time? Well, in a trend, you look at past information, you look at right now information, and then you try to make some type of guess as to what will happen based on what happened before as it got to now, right? The trend study, if you do like short term, like what happened last week, what happened this week, so we have a good idea of what's going to happen next week, right? You're all going to come to research, and I'm going to make another video, and that's how it's going to go. But if you were to say, what happened last year to what happened this year to what happened next year, there's a chance that things will be different, and you're going to have less consistency. You're going to have less trust whenever a trend study tries to make basically a prediction about the future that is too far in advance. Typically, trend studies try to predict future occurrences in the short term. And then a correlational study. This one is going to try to establish a link between 2 variables. We talk about this later in the chapter, but it does not provide evidence of cause and effect. Basically, correlation does not equal causation. But the idea here is that if one thing occurs more frequently in a certain given time than another thing, we want to measure 2 things at the same time. If one goes up, does the other one go up, or does it go down, or does it not change at all? We want to see what that's like. If it's a positive correlation, which we'll talk about this in statistics, if it has a positive correlation, then when one goes up, the other goes up. If it's negatively correlated, when one goes up, the other goes down. And if there's no correlation, then when one goes up, nothing happens to the other one. Next is retrospective. We're still in the descriptive kind of category here. Another sort of term for retrospective is going to be ex post facto. This is just a shortened version of a Latin term, but it's weird, and how, like I've said from the beginning, if something is weird or Latin, or if it seems like an odd thing that the book points out, then it's probably important. Your boards love weird Latin phrases, so make sure you write that one down. The reason for a retrospective study is to investigate existing differences to determine possible causes. The independent variable here is not going to be manipulated, so you're just looking at 2 different variables to see if, was there an independent variable and did it cause a change in the dependent variable? The limitation here is that you can only determine a functional relationship. You can't determine a causal relationship. I think this meme is just, it's just nice because it's good judgment comes from experience, and experience comes from poor judgment. So sometimes you have to look at what happened in the past in order to be able to make better decisions moving forward. And that's what a retrospective or an ex post facto type of study does. It looks at what happened before, makes guesses as to what happened, and then how that correlates with what is current, in an effort to see what will. All right, the next one is experimental. This is probably the thing that you think of when you think of research interventions, right? You think of, okay, I have these two variables, here are my two groups, I'm going to manipulate something about one of them, one group gets something and the other group doesn't, and we're going to see what happens, okay? That is experimental research, and it's the one that most people think of. So the reason we do this is to investigate cause and effect relationships. So we go in and we say, we manipulate something, we change a variable of some kind, and we say everybody in group A has this variable and everybody in group B does not have this variable, and we're going to see, does the variable change this other thing we think it's going to change. The methods for this is going to be the manipulation of one or more independent variables. So the thing we change is the independent variable, and it's going to control what happens to the dependent variable. The dependent variable depends on the independent change. The control of the extraneous variables. So in this way, we don't want other things getting in the way and, causing an outcome. So when we manipulate these types of variables, we also step in and say, hey, while this study is happening, don't do these other things that could cause a change. So like, let's say we're studying toothpaste and we're saying, we're trying to find out if an ingredient in toothpaste A is effective at whatever we're trying to do. Maybe it's whitening, right? So is toothpaste A going to whiten based on the ingredient? Toothpaste B doesn't have the ingredient, right? But you send the people home, you want to tell them, hey, don't whiten your teeth. We want to see if the toothpaste whitens your teeth. So if they go home and half of them are using Crest white strips, we have no idea if the toothpaste is causing the whitening, right? So we want to control those other variables. And then the measurement of the dependent variable. So we need to have a way to measure the dependent variable consistently from like before we intervened and then after we intervened. And a lot of times with this method, we will use a control group. That's group B that doesn't get the toothpaste. The limitation here is that it's artificial. Because we manipulate it, it's not something that happens naturally in real life. We may or may not be able to say that it would work in a real life situation. So, we give the group toothpaste A and we tell them to brush 5 times a day with it, and they do, right? I don't know, those are good participants who are doing that for you, but they brush 5 times a day. Well, of course it makes their teeth whiter, because it's effective, but then when they go out into the real world, nobody's brushing 5 times a day. So are we able to extrapolate that outcome and generalize it to the population? We don't necessarily know, right? And then there's a decreased external validity. That's what that means. We may not be able to replicate it and make it work out in real life because it's happening in a lab. What happens in a research lab is kind of a unique situation. So examples of this are going to be the effect of intraoral sodium bicarbonate rinses versus the standard rinse of the periodontal ligament of dental patients. Wow, that's a mouthful. And then the effectiveness of calculus removal with hand instrumentation versus magnetostrictive ultrasonic instrumentation, right? These are the types of things we might introduce one and see if it affects the other. Last in this box on page 199 is going to be quasi-experimental. This always makes me think of Quasimodo from the Disney movie. This is an experimental research design, but it's not a true experimental design. It lacks a certain amount of control. And here we talk about decreased internal validity, and I'll put that in the next slide. It's going to lack control of certain extraneous variables. This is going to be where the independent variable cannot be randomly assigned. Usually this is some type of innate characteristic that you're studying that it means that you don't get to randomly pick. A good example of this is if you were going to study some experience that tall people versus short people have, you're not going to be able to randomly assign whether someone is in the tall category or the short category, right? They're either tall or short depending on where you draw the line here between both of them. So you don't get to pick. They are, they automatically go into whichever category that they fit in. Also kind of a good way to think of this is that a quasi-experimental design makes people who like control and randomization, it's going to make those kinds of people queasy, right? Queasy because they're control freaks and they want to control every aspect of the study. So in that chart, your book alludes to internal versus external validity. And it talks about both of them just a little bit, but it doesn't really explain what those validity types are. And so this is just a really short understanding of it, and we'll go into more depth in a later module. But basically, internal validity is that the study measures what it's supposed to measure, and it does so properly. So basically, if you were, doing probing depths and you were using a broken probe or a bent probe, you're going to have very low internal validity. You're measuring and you might be close, but you're not actually, you're not doing a good job at measuring what you're supposed to be measuring, and you're not going to get very good results, right? That's going to be low internal validity. When it comes to external validity, this is that the study cannot be extrapolated to the general population. So we might be studying what kind of diets people might follow in a lab, but then when they go home, are they going to keep following that diet? And that's if they're going to do it in a lab, but then when they go home, they are not going to do it, well, then how good is our study, right? It's not as good. It has low external validity. So the idea here is that while you're inside the study, are you able to get consistent results? And then in external, once it leaves your study, will that information that you give them, is that going to give you consistent results? And so that's what they mean when they talk about these two. One of the types of research designs that if you were going to put together a study from the retrospective approach might be a case control study. And in this one, there are going to be two groups that are compared. And it's important that you don't confuse a case control study with a case study. In a case study, there is one person or one incidence that is being studied, right? Being looked at. In a case control study, is going to be a group of people that are broken into two. In one group, the case group is going to have the condition or the disease that whatever the researchers are looking at, that's what they're studying. They're going to have the condition. While the other half or group or arm or however you want to look at it, on the flip side, the control side or the control group does not have the condition or the disease. So in a case control study, it's telling you, hey, we looked at a lot of data from before. Half of the people we looked at had the case, had the condition or disease, and the other half didn't, and we compared these results. This is what we found based on that information that we looked at. So in this one, the dependent variable is whatever is being studied. Okay, it's going to be the outcome, although this is again worded weird. I might change this. It says the dependent variable may be a new drug or surgical treatment, right? The dependent variable isn't the drug or the procedure, it's the outcome after the drug or the procedure. the variable that will influence or is going to impact the dependent variable is the independent variable. All right, and then, so moving on past some of those studies, we get to page 202. This is box 16-1, and this looks at, this is on page 202. This is on page 196 at the bottom. This just looks at the types of characteristics that your research has to fall into. So any research hypothesis has to be ethical. We can't say, hey, I'd like to research how people feel when I cut off their arm, right? We wouldn't do that. That's not ethical research. Interesting, but not ethical. Necessary research that has the possibility to improve clinical practice and improve health policy. So we don't just research stuff for the fun of it, right? We want to research things that will help people, that where the information is going to be of use somewhere. And we want to either confirm or change previous theories. So we might say, you know, all along we've been removing calculus, and maybe somewhere along the line we want to say, what would happen if we left the calculus? Like, why can't we leave it on there? Our bodies make it naturally, right? Maybe we want to challenge old beliefs for things like that. And then we also might, perform the research if it's going to recommend future research directions. So this one's more like your pilot study. So, you might perform a pilot study in order to be able to see, should I continue to research this in the future? Should other people research this? Staying in that same box, at the bottom it says fundable research that includes an adequate number of subjects. So the reason you did the pilot study was to find out, is this study going to actually find the answer to the question that we have? If so, then we need to make our sample bigger so that it will be more valid, which we'll talk about when we get to validity. But the bigger the sample that we have, the more likely that the results we get aren't due to chance. So we want, if we're taking money from people, we want to make sure that our study is going to be big enough to be able to actually give us a good answer. And then if our study is cost effective, because we never want to waste money, obviously. And then is the study manageable in terms of the projected scope? So, obviously, yes, we want to have as big a study as we can have, but we don't want to go so big that we aren't able to collect the data that we need. And then involves professional expertise. So they don't just give study grants to people who've never done this kind of thing before. Typically, you'll have like a lead or like the first author or things like that in the study. That's kind of the go-to person who's done this before, and they know what they're doing. And then it's not just someone who is, done research before, but also someone who's an expert in that field, so that they're able to, set the study up appropriately. All right, so again, in experimental research, I want you to also kind of pair this with the term clinical trials, because usually in experimental research, it has passed the part where we're just gathering information and we're actually randomizing and sampling and all of that. It's probably the research that's most familiar to people. This is the one they think of when you think of research. And in this type of research, the experimental treatment or the intervention, the experimental research or the intervention is actually called the independent variable, and is studied in a group of people or animals. So the intervention portion is independent, and the thing that we're trying to figure out if it's affected is going to be the dependent variable. Maybe I'm just reading this wrong right now, or just weird right now, but basically, like for brushing, if we want to see if brushing will affect gingivitis, right? The brushing is going to be the independent variable. That's the thing we're going to change. And the gingivitis is the thing that's going to be affected, right? Gingivitis doesn't affect brushing. Brushing affects gingivitis, okay? One aspect of the experimental approach are going to be confounding variables. And there's more than just these two, but these are the two that your book talks about. The first one is the placebo effect. The placebo effect is a confounding variable. It's not the same thing as a placebo. So a placebo is basically a control. You're in, pharmaceutical research studies. This is the sugar pill, or the half of the group that aren't actually getting the treatment, right? But they don't know that they're not getting it, right? This is in at least single blind if you're getting a placebo effect. They think they might be getting the treatment, but they don't know 100% for sure. And in the placebo effect, some of those people who are getting the placebo will get better for some reason. And it's kind of one of those things that's a mystery in medicine. Why do some people who aren't getting the treatment, why do they get better, right? We don't know. That's the placebo effect. Your book says between 15 to 35%. I've also always read about one third of people who get the placebo are, it's possible that they will get better on their own. The other one is going to be the Hawthorne effect. This is also considered just kind of like the attention effect. And it is where you have to think about someone being watched in a study, whether or not they're doing the things that they would do when they're not being watched. So, for instance, when the boss comes out and starts watching workers work, they probably get a lot more work done than they do when the boss is not around, right? In the same sense that when the researchers are watching or following up on someone, that person might not be doing the things that they normally do. For instance, if you joined a research study and you were having maybe your diabetes studied, right? You might, during the course of the study, not eat as much sugar, or you might, have a better diet. You might make better choices and not eat as much, fried food or fast food or things like that, because you're in a research study where they're looking at your diabetes. So the placebo effect, people get better on their own. We don't understand it. It has nothing to do whether or not the drug is going to help people or not. And then the Hawthorne effect, people get better because they act differently than they would when they are not being watched. All right, and another very common approach when you are conducting research is to have a certain amount of blind. So a single blind study means that the participant doesn't know if they are receiving the intervention or the control. In a double-blind study, both the participant and the researcher who is administering that treatment or intervention or whatever it is doesn't know. So back to pharmaceuticals, if the person is receiving the drug or the placebo, right, the person taking it doesn't know, right? Because if they knew they were taking the one that's not the drug, then they might not get better, or they might not behave a certain way. So we want them to think it's possible they might be getting it. But if, the reason we would double blind, so right, the participant doesn't know, why would we want the person handing out the pills to not know whether they're the treatment or the thing? Is because if they know that the person is getting the medication or isn't getting the medication, there's going to be some kind of tell, right? Nobody is very good at, hiding information. So it's possible, that they might behave differently than, with one group over another. And they might pay more attention to one group over another. So let's say I know that the group, that the person that I'm talking to in a research study, that they're getting the placebo, and then they come in and they're listing all of their side effects. I might be a little less I might not care as much about the side effects that they're listing because I know that they're not actually the side effects of my medication, right? So I might not be as diligent and as meticulous in my, recording if I know the person isn't. If I have no idea that person comes in and, there's a chance they're taking the treatment, but they might not be, then they come out with this list of symptoms, then I'm going to be, paying attention to every detail because I potentially don't want to give medications to people that will have terrible side effects. So the only thing that ever bothers me about research is when people get a lot of the terms mixed up. And so I heard once that somebody was saying that the thing was triple blind. And it just meant that, all three parties of the thing were, nobody knew what was going on. And that, I don't know, that's one of my pet peeves is when people use research terms like completely incorrectly to mean other things that they just don't mean. And so you can have blind and you can have double blind, but beyond that, you can't have any more blind. There's either one or the other. Moving to pre-test and post-test. So in this one, what they'll do, researchers will give participants a test in the beginning, then they'll do the intervention, and then they give them a test at the end. And what they're trying to compare is how much did the person change, how much did the participant either, learn or grow or whatever it is from the first time they tested them until after they tested them. And this is really effective in a lot of places except for education. And then post-test only is where they don't test people before. They intervene in whatever it is and then they just test them after. If you think about, both of them are used in education, but post-test is pretty common, right? We come in and we say, here's the intervention is all of the the material that we throw at students, and then afterward we test to see, hey, how much of the intervention or the knowledge, the material did you actually get, right? The Solomon 4 group design, this is where they want to make sure that people learned, right? For instance, through education, they want to make sure that people learned the material because of the intervention and not because of the pretest. So sometimes when you take a pretest, it kind of clues you in on the things that are important that you'll need to learn, right? So when you take a pretest, you have a list of things you're going to start paying attention to and you're prepared for when you see them. So then when you see them in the intervention, they stick a little bit better, right? So in a pre-test, well, in the Solomon 4 group design, what they do is they break them up. So if this pre-test and post-test is group 1, and then post-test only is group 2, they'll put half, well, 1/4 of the participants in this first group, and they'll put the other in the second. And so they'll break people into 4 groups. And so in this first group, these people are getting a pretest. They'll get the intervention, right? And then they get the post-test, okay? But in the second group, in B group here, they're going to get a pretest. Man, writing with a cursor is tough. They do not get an intervention, and then they get a post-test, okay? And what's this group is gonna tell us, did people learn from the pretest? Did they cue into whatever this was? And so then when they took it again, they learned from the test and not the intervention. And then in this bottom group here, they don't give people pretests, but they do give them the intervention. And then they give them the post-test, okay? And then in group B over here, man, these guys are really hung out to dry. They don't get the intervention and they don't get, oh, let me put the X over here too. They don't get a pretest and they don't get an intervention. All they get is a post-test. All we're trying to see is where did people start out because they didn't get anything else. So that's how this works. In this Solomon 4 group design, we're going to be able to figure out, one, does the intervention work, which is the whole point of our research study, but also, did people learn more from the pretest, or did they learn more from the intervention, or, you know what, maybe they learned more from having a pretest and an intervention. So that's how that works. Next concept is going to be calibration, and it's always based off of the researcher. Whoever is measuring whatever the data is, right? Whoever's collecting data needs to be calibrated. And so we have two different types of calibration here. And if you think about them as like intra and inter. So intra-examiner calibration is going to be a consistency within a single researcher to measure the same each time. And typically this is done through tools. So like if I were using like probing depths, for instance, it's important that I'm always using the same amount of pressure whenever I'm doing probing depths, that I'm always using the same angle, and that that I use the same probe, right? The same type of probe, at least one that is not broken or bent or any of that. So that way, every single time I measure something on a probing depth on someone, I'm going to get consistent results. And then inter-examiner calibration is going to be consistency between researchers. So, when we go in and we say you're allowed to be 1 millimeter off, right? That's because between any two people, we expect about a millimeter difference. Even if we're doing all of the same things correctly, we're using the same amount of pressure, we're using the same angles, and we're doing the same type of probe, but we're doing all of the same things the same, but there's always going to be just a little bit different. And I mean, every time you probe the same person, you're going to be a little bit different. So here, if you think of like intravenous, right, is inside your veins. So that's the one person, right? And then inter-examiner, if you think of the interstate highways which run between state lines. So intra is within oneself and inter is between researchers. Okay, so in keeping with more of those designs, those experimental approach designs, we have something called the crossover design. And this one is meant to really prevent those what ifs in a research study. So, if I say this toothpaste can reduce gingivitis, and the person will go, well, what if that person just didn't have gingivitis? What if that person eats a different diet? What if that person, does it was such and such different, right? A crossover design is going to prevent those kinds of what ifs based on those other variables when we break our participants in half. So let's say in group A, arm A here, the participants get the toothpaste, okay? And we see, does their gingivitis improve, or does it not improve? And then in group B, they don't get the toothpaste, and we're going to see, does their gingivitis improve, or does their gingivitis stay the same, right, or get worse? And then we have a period where we watch them, right? We measure them in the beginning, and then we measure them at this point right here. And then what we do actually is we have something called a washout period where we stop giving them treatment for a little while. We have them kind of go back to normal, like reset their default settings. And then we bring them back in, but we switch them. So in group A, they were getting the treatment toothpaste before, but now they're down here and they're not getting the treatment toothpaste anymore. And then here for group B, they weren't getting the toothpaste. They go through the washout period, and now they are getting the toothpaste. And so then we measure them here, and we measure them over here where, we want to see amount of time. Did their gingivitis improve? Did it stay the same, or did it get worse, right? So in this one, if this person was just someone who doesn't build up a lot of calculus, and this person builds up, group A doesn't build up calculus, and group B does build up a lot of calculus, we're not really necessarily looking at calculus buildup for the purpose of our study, right? But I mean, ideally, one person is going to build up calculus consistently. If it has to do with other factors, then they would between two different people. So that way, if this person builds up a lot of calculus and the person B doesn't, or vice versa, however it works, that's not going to be a factor in whether or not my toothpaste affects gingivitis, because I tried it on that person, and then I'm going to compare. So maybe their gingivitis here improved. Maybe it's a good toothpaste. And so when they were getting the treatment, the gingivitis improved. But then when they were down here and they weren't getting the treatment, their gingivitis stayed the same. Okay, they're inflammatory markers, let's say. And then in the opposite side, because my toothpaste is statistically significant and it works, then down here for group B, this gingivitis would have stayed the same or even potentially have gotten worse. But then after the washout period, they came up here and were getting the treatment. And so suddenly their gingivitis is going to improve. The split mouth design is where instead of having this person, go through this whole process and then swap and then go through this whole process, what I do is I take their whole mouth and I just break them in half. And in this one person, I have this half of the mouth where they're getting the treatment and this half of their mouth where they're not getting the treatment. And sometimes in a split mouth design, they will still do a washout period and go again a second time because they want to see does it really, if you have a split mouth design and a crossover design, you're definitely going to find out if your treatment is correlational. So here we do the same exact person because the idea is that if I test on all of basically the same participants, then I don't have a lot of variety between person to person because I use all the same people. All right, so because this book is only has like a chapter or two to really discuss all of the research topics, we introduce sampling here. This book doesn't go into sampling very in depth, but your patent book will. So we're going to have a whole module on sampling later. But we're just going to introduce some of these sample sort of terms. And the first one is going to be random sampling. So if you think about like if we just drew names out of a hat, everyone whose name is in the hat is eligible to be chosen, and they all have the same chance at being chosen. They all have the same percentage or equal chance. And then in a systematic sampling, let's say I have my whole population here, and I'm just going to kind of put all of these people in a line. And then I'm going to choose every nth person. N can equal whatever number you choose. So let's say here I want n to equal 3. Not n necessarily as like the sample number, but nth is going to be the people I choose. So I'm going to choose this person, and then so this is the first person, second person, third person. I'm going to choose them, and then the next 3. Actually, that doesn't work that way. So not this person, because they're number 1, they're not number 3. So I would skip this person, choose this one, skip this one, choose this one, skip this one, choose this one. So that's how every nth person works. That's systematic. But that doesn't necessarily mean that every person, like let's say I lined them up like man, woman, man, woman, man, woman, man, woman, right? And then I chose every second person, or even just if I choose any even number at all, right, I'm going to get all men or all women. So I might want to break people into groups, and I'll have this group is men and this group is women, and then I'm going to line them up inside there and choose every third person. Does that make sense? Convenience sampling. Oh, I'm sorry. When we break them into groups like this is called stratified. Stratified systematic sampling. Convenience sampling is where I have a population, but I have access to a portion of that population. So maybe all of the people who come in to the dental clinic are the people that I have access to here in the San Antonio area. So I'm gonna pull my sample from these people, and all of these other people that didn't make it into the clinic, I'm going to say that the information I find in my study, relates to them, that it will work for them, but I'm not going to give them a chance at being included in my study. So that's convenient, right? Because I have access to certain people, but it's not necessarily the best way to pull a sample. And then judgmental or purposive. So in this one, let's say my study is on, dental hygiene of people who are green. So I might only study people who are green, right? And so if I do this, then I'm using my judgment to say, well, green people, know about dental hygiene, so I'm going to only study these guys. As opposed to studying everybody and finding out, do green people actually know more about dental hygiene, right? That's the problem there with judgment, is that there might be variables that I can't account for, but I'm going to use my judgment to choose my sample and not let it be random. It's important that your sample is a cross-section of the population. And what this means is that, you're not studying all women, or you're not studying all green people, or you're not studying, all adults over a certain age. You want to have enough variety in your study sample that you're able to relate it to the general population. And the biggest example of this not happening is in pharmaceutical studies. So for the longest time, they didn't study women because when they did drug studies, the last thing they wanted was for a woman to become pregnant in the middle of the research study and for her to have to drop out because they didn't want to harm the baby. Or, heaven forbid, they were giving them a medication that does harm babies. The woman didn't know she was pregnant, and then, they've caused some harm, right? They don't want to do that. So for ethical reasons, they decided to only study men for certain medications. Well, the problem with that is that women don't respond to medications the exact same way that men do. Women aren't just smaller versions of men, right? We have different DNA. And so what happens is that because they only studied a certain section of the population, there is some bias that's there. So when they say it could have this side effect, this side effect, this side effect, they're not probably going to even know about the side effects that it's going to cause to a woman's reproductive system. This happens a lot in blood pressure and heart medications, because when they were first coming out with a lot of the more common ones, they were only studying men. And so now women react differently to heart disease than do men. That's actually a topic that I really think is fascinating. That I took a whole class on. That was like the differences in men and women as far as our health goes, and the fact that a lot of the treatment that's being done for women is not even studied on women. Okay, so we've made it through most of this chapter now, right? We came up with our research question, we figured out our research design, what kind of research approach we were going to take, and the design we used within that approach. And then we figured out, do we want to have a blind? Do we want to have a double blind? All that kind of stuff. We figured out, what kind of sample we were going to choose, so how we were going to go about finding our research participants. And then you collect data. That's what you do. You have your examiners calibrated, and they collect all of that information. Usually they put it into some type of statistical analysis if your data is numerical. If your data is not numerical, then you probably have a couple of people who are analyzing that data and trying to find, key terms or finding, correlations in the responses, things like that. The thing here that is probably, again, my favorite aspect of research is it's addressed in The Dread Tomato Addiction by Mark Clifton. This is in box 16-4 in your book. It's on page 207. And it's really where you can see how if you're not looking at the big picture of a study, you can get caught up in details and then make statements that that aren't true. So in this one, it talks about 92.4% of juvenile delinquents have eaten tomatoes. Okay, 87.1% of the adult criminals in penitentiaries throughout the United States have eaten tomatoes. So informers reliably inform that all known American communists, 92.3%, have eaten tomatoes at some point in their life. 84% of all people killed in an automobile accident during the year 2000 had eaten tomatoes. Those who are subject to singling out specific groups for statistics require measurements within a total. Of the people born before the year 1850, regardless of race, color, creed, or caste, and known to have eaten tomatoes, has been 100% mortality, right? So every single person who died last year ate a tomato at some point in their life. I'm not going to keep reading this, but what this tells you is that according to this information, if you're not looking at the big picture, you might think that tomatoes cause juvenile delinquencies, that tomatoes cause criminals, that tomatoes kill people. But that's not necessarily true, right? Just because two things both happen simultaneously doesn't mean one causes the other, okay? Correlation doesn't equal causation. The example that I had heard when I first started, and I had my epiphany of how this works, was that in the summertime, there is more boating accidents, because more people get into boating accidents. Also in the summertime, more people eat ice cream. Okay, so if you were to look at these, they're positively correlated, right? So in the summer, more people get into boating accidents and more people eat ice cream. You might think that eating ice cream causes boating accidents, right? But it doesn't. They just happen to happen at the same time. So the factor here that we don't account for is the fact that it's summertime, and both of those things happen when the weather gets warm. That's how all of that correlation data works, right? That is why no single research study can prove a hypothesis, okay? No single one can, because there is potentially flaws in every single research study that is conducted. You have to have validity and you have to have reliability, which we're going to talk about, but you have to be able to reproduce that research study and see if it happens again and again and again consistently. Because there's always a chance, and you try to account for this, but there is always a chance that your results were what they were just simply by chance. You just happened to get people who got better. No research study can be applied beyond the population that was studied. So, if you studied adults between the ages of 20 and 30 and you found a toothpaste that helps to reduce gingivitis, but all of your sample was between 20 and 30, you cannot say that toothpaste will reduce gingivitis for everybody, because it might not, right? It might not work on kids and it might not work on older adults. So only make generalizations based on the population that you studied. And then the third one here is in the conclusion portion is going to be that the information should be peer-reviewed and published. So if you collect data and you go through the entire research process, and it's a good question and it's a significant question, it's going to help the body of literature, then it is your responsibility as a researcher to publish that research. Even though publication can be tedious in certain scenarios, you still have to do it. You have an obligation by collecting information and having that knowledge to share it with others. And then you want to share it because it will go through a peer review process. So if you have your information and then you start only teaching people the conclusion of your study and you don't get a peer review process, there's a chance that there's a variable that you didn't account for and you're not 100% sure of, and so if you don't let others read your research and evaluate whether or not it was a good study, then no one can trust that you performed a good study. So you have to let other people in on all of those details and essentially let them critique you and let them pick apart the study that you conducted in order to see, does that study make sense from all angles? This is the end here. This is the last part of this chapter. All right, so totally unrelated, but this is my cat, Lady, and I didn't know there was like YouTube videos where you could watch just like birds and squirrels eat food. They're like meant just for cats, and so this is Lady watching the video. This is like how I work now, where I have to save a little tiny section of my computer space just for a video of a squirrel. But yeah, that's the end of this chapter. I know it's completely unrelated. It's a waste of time. But if you have questions, please make sure you let me know.